Family Violence, Chapter 3, Child Neglect and Psychological Maltreatment. This is a narrated version of this PowerPoint presentation. Child neglect. What is child neglect? Some of the issues that affect the definition of child neglect include comprehensive definitions, lack of agreement, intentionality, harm standard versus endangerment standard, frequency and duration, the chronic nature of neglect, and neglecting the unborn child. Typologies of neglect, specific behaviors, emotional neglect versus psychological maltreatment, medical neglect, cross-cultural abuse, Dutch prevalence studies, and Romanian infants. Prevalence and incidence of child neglect include official estimates and self-report surveys. Effects of child neglect. We look at issues related to early neglect and unique effects. Expanded research on the effects of neglect. Attachment difficulties, Minnesota longitudinal study, cognitive and academic deficits, emotional and behavioral problems, and physical consequences. Characteristics of neglected children and their families. Characteristics of neglected children, the NIS-4 between 2005 and 2006, with a sample size of 771,000. 61% were neglected according to the harm standard. U.S. Department of Health and Human Services in 2008, 758,000 maltreated children. Sex of neglected children, race of neglected children, no significant racial disparities in percentage of neglect. Disability is also an issue. Characteristics of neglected parents through the NIS-4, gender differences and risk factors are looked at, and parent-child interactions. Child psychological maltreatment, lack of focus on child maltreatment. Definitions of psychological maltreatment. What is psychological maltreatment? Issues related to the definition include focus of definition, child outcomes, parental behaviors, and parent-child interactions. Prevalence of psychological maltreatment. Issues related, mandated record keeping, self-report surveys of psychological maltreatment. Effects of psychological maltreatment, long-term effects of psychological maltreatment, issues, mediators of effects, and neurodevelopmental effects. Children exposed to interparental violence, historical introduction, co-occurrence of child abuse and domestic violence, defining exposure to interparental violence, issues, active omission or commission, importance of definition, and specific aspects of defining exposure to interparental violence. Prevalence of exposure to marital violence, effects on children's exposure to interparental violence, research findings about children exposed to violence, long-term effects of exposure to marital violence, and need for services. Characteristics of maltreated children and their families, issues, characteristics of maltreated children, resilient children, and characteristics of maltreating parent. Explaining child neglect and psychological maltreatment, issues, socioeconomic status, family structure and functioning, intergenerational transmission of maltreatment. Parental problems in neglectful and psychological maltreating families, issues, single parenting, presence of fathers, disabled mothers, mothers parenting in father-violent families, fathers parenting in violent families, mothers' legal difficulties coping with a violent father. Parental problems in neglectful and psychologically maltreating families continued. Issues, methodological issues pertaining to effects research are lack of a standard definition, inadequate sampling, polyvictimization effects, sources of report, research design, correlational data, lack of theoretical underpinnings, non-comparability of comparison groups. Practice, policy, and prevention issues for neglected children, children exposed to parental marital violence, and psychologically maltreated children. Practice, treatment. For child neglect and psychological maltreatment, issues are multi-service interventions, home visitation programs, and social support programs. Early intervention programs, examples, Healthy Families in New York, Nurse-Family Partnership, and USPPP, which is the Positive Parenting Program. Interventions for children exposed to interparental violence. Examples: group counseling, shelter programs, the Safe Start Initiative. Common problems in implementation for all programs: therapy dropouts, lack of correct implementation by workers, interaction with difficult children. Elements of a successful program. Policy issues: legal issues concerning parental behavior, neglect and maltreatment investigations, Safe Families Act, Safe Haven Laws, the Child Abuse Prevention and Treatment Act in 2003, and poverty: who is accountable for children's exposure to marital violence, and lack of available programs. This ends this narrated version of this PowerPoint presentation.